Good evening, everyone. Thank you for joining us to this special town hall hosted by the County of San Diego's Health and Human Service Agency and the San Diego Voice and Viewpoint. I'm Nick Mascione. I'm the director of the county's Health and Human Service Agency, and I'm joined this evening by my co-host and dear friend, Dr. John Warren, publisher of the San Diego Voice and Viewpoint. I want to start by thanking Dr. Warren for this opportunity to have a conversation with the community about strengthening families for child and family well-being. We have only the greatest respect for the Voice and Viewpoint and its importance for the Black community and indeed the entire San Diego community. This evening, we have a brief presentation on the county's efforts, but we're not just here to share what we're doing. We want to hear from you. We have a question and answer function here on the Zoom meeting at the bottom of your screen, and we're going to spend a majority of time addressing your questions and comments and suggestions. We also have interpretation services available in Spanish if you need it. You can select that option at the bottom of your screen. Again, we appreciate you joining us this evening and look forward to the discussion. And with that, I'd now like to turn it over to Dr. Warren.
Well, I am very happy to be here. Mr. Mascione and I have over a decade of working together on behalf of San Diego County. And I have encouraged people both through our weekly Black Men and Women United and e-blast that we've done with the paper. We've been encouraging families to take advantage of this opportunity to reconnect because a lot of people are still disconnected, but the problems have not gone away. And so I've encouraged questions. I hope they do send them in. Sometimes people are a little slow on that, but that is my concept of a town hall meeting, that we hear from people in terms of what they think and what they feel. And so with that, I'd like to just be quiet and move forward and hear those who have something to say and help in any way I can.
Thank you, Dr. Warren. You may be quiet, but you're very powerful and making sure we make improvements. So it's my pleasure now to introduce the county's Child Welfare Services Director, Dr. Kim Jardina. She's joined by members of the whole Child Welfare leadership team. As the director, Dr. Jardina has held and led multiple agency-wide efforts, including the development of the Future Generations Council, Trauma-Informed Systems, and Strong Families, Thriving Communities Coalition that focus on reducing disproportionality and disparities for children and youth involved in child welfare and the juvenile justice system. Dr. Jardina is leading the transformation of our child welfare system here in San Diego into a child and family well-being system. And with the vision of improving coordination, communication, and true partnership between family serving organizations in our county to help strengthen families and communities so that fewer children experience abuse and neglect. And with that now, I'd like to turn it over to Dr. Kim Jardina. Kim?
Thank you, Nick, for the introduction. And Dr. Warren, thank you so much for hosting this conversation. In Child Welfare Services, we really recognize the need to repair relationships with communities that have suffered from structural racism that is a part of the child welfare system nationally and here locally. And while we are on a journey to do that, we really need the community's help. Our struggle to help redefine and reimagine an equitable child well-being system is not something that those of us just working in the system can do alone. So I'm really grateful for this opportunity today, and I'm excited to get to engage with our community members. We know that racial disproportionalities and disparities within the child welfare system are a pervasive problem that have negatively impacted African American families throughout child welfare history. Structural racism is embedded in our public policies, institutional practices, cultural representation, and other norms within and outside of the child welfare system. And it continues to shape the current standards of what a strong and thriving family looks like. In child welfare, we've been working closely with a national consultant, Corey Best, to help us move toward anti-racist practices in child welfare. And our county has also been a part of this process. In 2015, the County of San Diego's Diversity and Inclusion Task Force was charged with creating a strategic plan. And immediately that following year, we also created a Diversity and Inclusion Committee in child welfare. But we know that we only scratched the surface during that time. And after the killing of George Floyd in May of 2020, as well as many other events that happened, I began a series of listening sessions with our staff about race and equity in child welfare. And we also started the Race and Equity Ad Hoc Subcommittee of the Child and Family Services Advisory Board. And through that, we recreated, with some community input, our Diversity, Equity, and Inclusion Action Plan to really place new concerted efforts on understanding and addressing disproportionality and disparity in child welfare, and to create an anti-racist organization. Some of the accomplishments include establishing the Child Welfare Services Office of Equity, and I'm pleased that Dr. Keisha Clark is here with me tonight, who leads that office for us. We've really been focusing on increasing our relative placements, and then really taking a look at our staff development. We use implicit bias testing with all of our new staff. We have our Cultural Responsiveness Academy that has actually developed the curriculum from the community, and many other opportunities for our staff. We also know that we need to be transparent and accountable about how we are doing and seeing if real change is happening. So I just want to share a couple of pieces of data. We have made some progress. If you go to this next slide, the number of African American youth entering foster care has decreased from 329 youth in 2010 to 171 last year. The next slide, the total number of African American youth in foster care has decreased from 817 in 2010 to 373 last year. With relative placements, it's gone up and down. We went from a 30% high in 2010 down to a low of 18% in 2020, and back up to 25% in 2021. And as you can see from all the slides, although our numbers have decreased dramatically, the rates of disproportionality and disparities still remain high for African American families. We know that one important aspect of an anti-racist child welfare system is to ensure that our staff come from, represent, and look like the communities they serve. We do have a diverse group of staff within child welfare and have focused on enhancing opportunities for staff growth and development. I'm excited that now 20% of our leadership team in child welfare is made up of African American staff. We also know that the more we can help strengthen families, we can work to ensure that they never have contact with the child welfare system in the first place. So as Nick mentioned, we are embarking upon a transformational shift to really invest in prevention and family strengthening, minimizing the use of family separation and foster care only when it is absolutely necessary and for the shortest time possible. Our transformation toward a child and family well-being system will help build stronger families and communities so that even fewer children will experience abuse and neglect. By turning our child welfare system upside down with a focus on equity, prevention, and supporting working families, we can help provide families with the supports they need before foster care becomes a necessary intervention. We know that working with our communities will be absolutely essential for this. We know that mandated reporters need to become mandated supporters, in which our entire community focuses on a better way for child and family well-being. And by improving our coordination, communication, and partnership between family-serving organizations and our families, we can decrease the chance that at-risk families will ever have to engage with child welfare. We do have lots of strategies that we're working on to help us achieve this vision. We've been working on Faith in Motion, which is a collaborative effort between our faith-based organizations to really engage their congregations and come together to work collaboratively with us to wrap their hands around our families. We're implementing new state legislation that gives us more leeway to grant exemptions to relative caregivers who might have a past criminal history. We're working on a community response guide to help provide decision support to mandated reporters, helping them really consider whether they have potential areas of bias into the reasons why they're reporting, and help guide them to other supports that families might need rather than just calling and making a report to child welfare. We're developing a prevention pathway hub to provide community-based access and a no wrong door approach for families to have the resources and supports they need. And I'm really excited the Board of Supervisors approved a cash transfer program that will provide direct cash payments to families who may be at risk of their children entering foster care as a way to provide concrete supports to families in times of need. I'm excited about the journey that we are taking in child welfare, but like I said earlier, we know we need the community's help to accomplish the vision for a child and family well-being system. And I'm happy to share more details about these if people are interested, but we want to make sure that we really get to hear from our community members who are participating tonight. So I'm going to turn it over to see what questions we might have from our community.
Thank you, Kim. It looks like we have a question or so already submitted, but as Kim just pointed out, as we mentioned from the top of this forum, really this evening, we would love to get your questions and any feedback you have. Please use the Q&A function at the bottom of your screen, and I'll turn it to the team to see if we had our first question. One question that did come in was it's an opportunity for you to summarize again key points, but I think it's the question is leading to what is being done in child welfare, Kim. So maybe in taking that question as as it relates to our work now in serving Black families, if you could speak a little bit again, elaborate on that, some of those efforts, that'd be great.
Yeah, no, thank you. So, I think we are really trying to take a look at, all the different components of our system. So starting at the prevention area, how do we prevent families from even needing to come into contact with child welfare? Working very closely with our partners at the First Five Commission and building on the great work that they have done for many years. How do we make sure that families have access to the resources and supports they need in their community in a way that's really responsive? And when they need it, that they shouldn't have to, struggle to try to find those resources. We're also taking a look within our child welfare system. So we've been working, with our staff to make sure that we're really addressing issues of bias that may happen in our decision making and in our assessments of families and the work that we do with our cases. We've actually been working even really closely with our court system. Judges and attorneys are often involved on our families' court cases, and we know there can be issues of bias related to that. And we're really lucky that our court partners have been walking alongside us in this journey to help us really rethink the way that we assess and work with families. And then all the way through, when we look at placement options, we know that kids do better when they are with family. We know that kids do better when they maintain those cultural connections. And we have not always done so great at keeping kids placed with relatives. Some of that has been due to some changes in state law. But last year, there was a statewide piece of legislation that allows us to, as I said earlier, review and assess differently some of the criminal history that a relative may have in their past. We know there are disparities in our criminal justice system, right? African-American families, African-American men especially are much more likely to come into contact with the law enforcement system, and that can have an impact on whether or not we can place a child. But now we can actually really look at that and determine, are there any current concerns for safety? And if not, really benefiting from that relative participating in the life of the child. So we're trying to take a look at, each component of the system and see where can we do things differently? How do we begin the transformation along the whole spectrum for our families?
Nick, I have
Dr. Warren.
Yes, I have a couple of. Can you hear me?
Yeah.
Okay. Okay. There are two things that come to mind that are great concern to me. Number one, historically, and I'm looking at the chart, I see the renewed emphasis on placement with family members, but historically, I've had a lot of cases where people have come to me and said that rather than completing the reunification process, when family members have been identified and come forth, there's been an effort to push out the adoption placement, the foster placement, rather than the reunification. So I think that's one of the issues we have here, is that we need to have people understand more of the things that you are describing, because your description and the reality that some people have appear to be two separate worlds. The other piece I want to raise is when you mention the faith base. You know, I remember when Father Clemens in Chicago started the One Church, One Child, and that program led to my late wife and I adopting. And people were encouraging the churches to get involved with Black kids without looking for a check or a stipend. And so I'm curious when you mentioned faith-based, because we didn't use the title in those days, we just said churches and encourage churches. So are there any churches taking any leadership roles to encourage placement? If so, that's the kind of thing that I would really, you know, like to be able to share with the community.
Yeah, so those are great questions, Dr. Warren. So let me address the issue around reunification and adoption. Yeah, I think you're right. I think in the past there have been pushes for, you know, do we have kids get adopted, you know, out of the system? Our primary goal is reunification. 60% of our kids in child welfare do reunify with their families. But that means 40% don't, right? And so, but that could still mean that of those 40%, how do we make sure they're connected to their family, even if it's not reunifying with their parent, right? And so we're really trying to make some shifts there and focus on keeping kids with family, even if they can't necessarily go home to their parent as part of the reunification process. You know, that's going to take a long time for us to shift. That's a big culture shift for us. And again, some of that has to do with some of the legal components that we deal with, but our team is really committed to, we know that if the child gets placed with a relative up front from that very first placement, it's much more successful. 75% of kids who get placed with a relative are still with that relative a year later. It's much more successful. And so if we can do that, we think we have a better chance of really keeping kids with their family.
Okay.
The other question, now I forgot your other question.
It was about the faith base and
Thank you.
We can track what the churches are doing.
Yeah. So I know One Church, One Child, and I think you know, we have been really excited here to re-engage in our Faith in Motion work. You know, we have started and stopped this work over time, and that has not been good. You know, we have not necessarily been you know, fully engaged with our churches around this. Dr. Clark and one of my other deputies, Lillian Asawera, have really been leading our work in this area. I know City of Hope, True Vine Baptist, our San Diego collaborative churches have all been really great pieces of this. We're working with a community-based organization, Restoration 225, St. Paul's, the Faith-Based Action Coalition. And so we really have about 20 plus churches who have really taken an active role in this. We want more. So if we have other church partners who want to join with us, we would love to reach out and engage with them.
But how many of those churches have resulted in placements?
Several, but we're also not approaching it just from a placement perspective. And so it's really about how do we come together to wrap around families. So can we prevent, you know, help a family to prevent the need for foster care? If kids do need to come into foster care, can we support those relative placements? So an example, we had one of our churches, we had kids who did come into care. We wanted to get them placed right away. The church went and bought all the supplies that the caregiver was going to need so that we could get those kids placed that same day. They didn't have to go to Polinsky. They didn't have to go to another foster home. They could just go straight to that relative.
Thank you.
Yeah.
Thank you, Dr. Warren. We have more questions now have come from participants. So let's jump into those. And Dr. Warren and I will be kind of sharing some of the questions. I'll jump in the first one or two. Next question is, what is the most common issue families experience that lead to child welfare need?
That is a great question. And I don't know that there's any one necessarily issue that we see that leads to the child welfare need. I think what we see in families are struggles with intimate partner violence. substance use issues, challenges with mental health needs. We also know that there is a high correlation between families who struggle with poverty and those who become involved in the child welfare system. Nationally, and that is true here for us in San Diego, neglect is actually the biggest reason why families become involved in the child welfare system. So that's one piece I'm really excited about, being able to start our direct cash payments program. If we can really tackle some of these issues that are related to poverty, I think we can address some of the underlying causes that really bring families to the attention of the child welfare system.
Thank you, Kim. Next question is Pat Bevelin. Pat, thanks for joining us this evening. The question is, although the number of children entering the system has decreased, the number of petitions filed on Black children is 25%. Black population in San Diego is 4.5%. What efforts being done to reduce the number of petitions filed?
So we have been working really hard on sort of our assessment that we do in terms of families. One thing that's required is that we have to file a protective custody warrant for most of the time that we bring children into protective custody. So that warrant has to be signed by a judge in order for us to do that. But for us internally, a couple of years ago, we implemented what we call chiefs of practice. And those chiefs of practice, their responsibility is to make sure that we are doing good quality child welfare work, that we're doing our assessments the right way. So they do a review of families and making sure for our African American families that there's a review of those cases to see whether or not we really needed to remove that child. Is there some other intervention that we need to do? And so I think that that has been helping as we've seen, the reduction in the number of African American youth entering foster care. We've also been trying to work on just again, sort of some of that upfront prevention work that we can do with families. For us, it's more like secondary prevention, since a report has already been made to the hotline. But how do we take a look at our partnerships and working with our community-based organizations? We have parent partners, which are partners, families and parents who have gone through our child welfare system, who can work directly with parents and really try to help us create a plan for safety. We work really closely on incorporating what we call child and family team meetings before we ever have to remove a child. So bringing together the family and anyone who's important in their life to a team meeting so we can talk about what are the concerns and what's the plan so that we can try to prevent that child from coming into foster care.
Thank you, Kim. And by the way, I want to thank our interpreters because they're trying to keep up with as fast-paced questions and responses. We have two more questions, so thank you for those submitting. Zonice Jones writes, Kim, you indicated that the disproportionality of African American children accessing the child welfare system is due in part to discriminatory practices and racial bias. My question is, what punitive actions taken to correct and eliminate this type of behavior of those guilty of this conduct and causing harm to our children?
So I think, this is a piece that we have been really working on in terms of, one, educating our staff. We know that racial bias doesn't just exist, within our child welfare system, right? It is usually occurring and is really baked in as part of the system. And so it is both individual work that we've been doing, me personally, asking our staff to do personally around our biases and recognizing those, but then also understanding the systemic structures that uphold racism within our child welfare system. And how do we look at dismantling those structures so that we can make sure we're making better decisions and working with families in a better way. So I think, we certainly take disciplinary action of staff that we need to. We have an entire process that we utilize to do that. And if we have really clear examples of staff who are, not following policies or really disrupting, families, we will take those actions that we need to. But it's equally important to me that we're really also looking at the systemic components. Otherwise, we're just going to continue to perpetuate some of these outcomes that we've gotten throughout our history.
I want to add to that because this is an excellent question and important. You have to be very intentional about it. So I'm going to turn this down next to Dr. Keisha Clark, who is really intentional about it in child welfare. We also have Elizabeth Bustos working across not just child welfare in every single one of our departments. So as Kim pointed out, this lives, and we know, beyond just any of the health and human service departments across society. But it's what we do about it, now intentional and holding people accountable, but also training folks and dealing with these up front. So Dr. Clark, I know I turned it up to you to speak a little bit about your work on this, and then if Elizabeth Bustos would like to add, and then we'll move into our next question.
Absolutely. Thank you so much. I'm going to echo what Kim talked about in that those actions are many times unconscious bias, and also, again, a systemic thing. So when we talk about being punitive toward individuals, we have a system, we do have policies. And so one of the things that I do, a part of my job, is to review policies through a race and equity lens. So when we are identifying that a policy is advantaging one group and disadvantaging another, that's easy to kind of give suggestions, give recommendations, pull the data and the research on, create racial equity reports to show how this is impacting certain groups. We also have training. We have, when our new social workers come in, we'd like to level set on, listen, we're we're trying to build. Please join us, by the way, here's a commercial. Please join us, by the way, to help us to rebuild an anti-racist system here. And so we are trying to look under the layers of what's going on here. We also have programs like our CRA for father engagement. When we talk about how we've treated fathers, how we currently treat fathers, let me correct myself, it's not just historically, but how the system has already kind of set up our court systems. And just remember, we're a part of a global interconnected systems that sometimes we are affected by that, by the things that other systems are held by. And so when we have our father engagement trainings, and these are like 9-month, sometimes year-long programs where we're trying to change the paradigm, change our mindsets about how we treat fathers and also paternal sides of families. And that's a part of, again, bias when we're favoring one side and not the other. And so this is something that is systemic and not just individual, and being punitive about it will not get us where we want to go, because many times it's an unconscious thing, or we're following a policy that needs to be looked at.
But let me be, thank you, Dr. Clark. But let me be clear, as the ACU director, we have zero tolerance for discriminatory practices, and we have taken severe discipline for folks that have been intentional about that. That is zero tolerance for us, not just in the Health and Human Services. I want to believe that's in all the county departments and hopefully all our cities. Dr. Elizabeth, do you want to add anything to this, or I'll take the next question?
Just really quickly, these are really hard, difficult conversations to have. We're talking systemic racism, bias, but to the point that I know Nick and Dr. Clark and Kim is making, that doesn't preclude us from accountability. And that doesn't preclude us from transparency in the work that we do. And it also doesn't preclude us from reaching out to you, here who are joining this conversation, to hold us accountable and to point issues and concerns out, just much like you're doing here. So very much appreciate the opportunity to chime in on that. Thanks, Nick and everybody.
Another question we got from our participant is regarding what you're seeing as concerns of children at the Children's Polinsky Center. Kim, I'll turn that to you.
Sure. Yeah. So, I mean, I think, we have worked really hard to make Polinsky a safe, trauma-informed place for our youth. And I think that, we have challenges there, but we have done a lot of work to really make some improvements. So, one of the things that we've really done is just not have kids go to Polinsky at all. So we are doing a much better job of getting kids to a home placement, whether that's a relative or a foster home, from the very beginning, from the day that they're removed. Today, we only have 29 kids at Polinsky as of today. And so, we're doing a much better job of just making sure kids don't have to go to Polinsky. But for our kids who do, we have really expanded a lot of the services and supports that we have available for our youth at Polinsky. So, for example, we've added an additional mentoring program for youth that we work with just in time for foster youth. So it's former foster youth helping to mentor youth who are newly coming in and understanding, how challenging that is and really traumatic for our kids who first come into care. We've added a recreational therapist so that we make sure we have more normal recreational activities for kids to participate in while they're there. We have our licensed mental health clinicians that can provide that mental health support for any of our youth who might need that. We've added partnerships with law enforcement. We have partnerships with iCare, which is our CSEC, our commercial sexual exploitation provider. And so for any youth who may be at risk of or victims of sexual exploitation, we have them on site and they have peer advocates. So who come and work with the youth who are there at Polinsky. We have staff psychologists who can go there and be of support. We've been working on utilizing the achievement centers. So we have some of our youth who are going to attend the achievement centers, which gives them an opportunity to work on different things after school and have that type of programming. So we're working really hard to make sure that the youth at Polinsky, that we're meeting their needs and that they have different opportunities. One thing I'll just remind people, the other piece that changed with Polinsky is our youth are really only supposed to be there for a maximum of 10 days. And so, if they have to go to Polinsky, the other piece we're working on is making sure we do get them placed within those 10 days. And so we've been much more successful at making that happen as well.
Nick, I think we should always give credit when good things happen. And as I'm sitting and listening to this, I'm remembering a different Polinsky Center that had too many kids, that didn't have all of the services that are being discussed. I'm remembering what Adolfo did to change the atmosphere in terms of those that were connected with the system. And so it is just encouraging when I hear the number 29, not that we want anyone, but for that number to be, that low. And I think part of the problem that we have when we have a session like this, we have too many people that don't have the institutional memory of you and I in terms of where this whole process has come from. And that gets to be very important, because if they can see what we've done to get to this point, then they can be encouraged going forward and not just have people have contact when they have a negative experience and then that negative experience just mushrooms. So I just wanted to give credit for what I'm hearing, because I'm not just hearing all of this first time. I mean, I've been listening and involved in this for like 20 some years, and it just represents major improvements.
Yeah, thank you, Dr. Warren. And I've been with the agency now 25 years, and some of the very folks that you have in the child welfare team have also been here a long time, and we've gone through a lot. And you're right, the days that we were putting kids in the gymnasium with the overcrowding and not the type of enrichment and services are long gone. And we're still looking at how do we make it better, and that's the importance. We wish we didn't have to have a Polinsky Center.
Yeah.
But we do, right? And so, and we are blessed because in our region, LA does not have one. and the horrors you hear about the children often in the cars of their social workers looking for placements and so forth is horrific. But we always are looking to do better. And so I appreciate looking from where we've come and where we're going, Dr. Warren. I think that was very important insights on your part. We have another question, and it's where to get Medi-Cal for youth ages 18 to 21.
So I'll answer that from if it is a foster youth or former foster youth who's between the ages of 18 to 21. So in California now, kids can remain in foster care up until the age of 21. If they remain in foster care, they are automatically eligible for Medi-Cal. Their social worker will make sure that they are enrolled. It actually kind of just happens automatically behind the scenes in our system so that they can have access to that. If they have left our system, any former foster youth is actually eligible for Medi-Cal up until the age of 26. We are obligated to make sure that they get enrolled in that before they exit. So if that didn't happen, let us know, please. We have our website. You can contact our Office of the Ombudsman because that should have happened before they left our system. And if not, we can help get that connected back through Medi-Cal. If you're talking just more broadly about all youth, not foster youth or youth who are former foster youth, that would be through our self-sufficiency services to be able to access those Medi-Cal services.
Thank you, Kim. Dr. Warren, I don't see any more questions. Unless you have a question, then we can wrap.
I do have a question, and I was listening. You know, when we talk about race and equity, the problem is that the people who have issues do not always wear those issues around so that they're visible. The issues just manifest when they run into the families or the individuals who are the targets of those issues, all right? And so this has been one of the problems that we've had. And I'm curious, like, and maybe you said it at the beginning, but what percentage of the social workers are African-American at this point?
13%.
What percent?
13.
13%, okay.
And Dr. Warren, if you remember, when we started this, we were not at 13%. That was one of the very things you and I talked about back in 2008. We were we were not nowhere we needed to be. So this has been also intentional about how do we bring in competent, passionate social workers that are reflective of the community.
We also want to bring in, Nick, another element that we've dealt with over the years, and it was missing here, because, you know, we often talk in terms of both the African and African-American community. And in our past town hall meetings, we made some tremendous progress in terms of getting interpreters with some of the various African languages that were not getting the same recognition, say, as Spanish or Tagalog. And so when we look at what we're doing here, is there, and maybe it was on the chart, I missed it, was there a percentage of African families that are engaged in the system at this point? Because
you know, we don't know that. The way that our database collects data, it makes it really hard for us to do that. That's an area we want to know more about, but I don't have that information.
Well, I would also suggest to you, when you look at it, you know, there are some cultural practices within those communities that go against our very laws. You know, the whole scenario that they have with the girls and what they have to, how they're treated. And a lot of people are carrying on some of those practices even here within the smaller community groups. And so I don't know how we look at that. I think that's an issue. And I know we have some other elements that we're going to touch on, Nick, so I won't jump ahead of us. But I just think that at some point we need to be trying to find out what's going on within that element, because it's increasing as we have more people coming across from Haiti that have been waiting. The refugees will fall into this category. We're doing a lot here in terms of collecting food and clothing and sending things down to them on a weekly basis. But you know, a lot of them have been sidetracked with the Ukraine scenario. So I just wanted to expand it, Nick, so that you know, we don't get focused in a way that we miss the rest of the elements.
Thank you, Dr. Warren. Absolutely. And as we had another question that came in, Kim, the community's hearing that children are being sexually abused at Polinsky. Teens are leaving for the weekend and returning at will. Pimps are picking up girls for the week and bringing them back. Also in the past, babies were rocked and held by volunteers. I don't think babies should be cared for by shift changes. What is the length of time that babies 0 to 12 months are staying at Polinsky, and are you seeking volunteers to help care for the babies?
Yeah, so I'll address the first part first about children being sexually abused, teens leaving. So a lot of the efforts that I described earlier were really specifically targeted at addressing some of those concerns, having our sexual exploitation advocates there on campus to work with our youth. We have had a reduction in the number of youth who are leaving or running away, which is great because we know that that puts them more at risk. And so giving them those opportunities to have those supports so that they are safe when they're at Polinsky has been great. In terms of our babies, on average, the length of stay for them is about 3 days. Right now, as of today, we only have one child who's little, under 6, who's there at Polinsky. So again, trying to make sure that we do a much better job on placement. So that is not, I don't think we've had volunteers, you know, obviously when we were in the midst of the pandemic, lots of in-person things went away and we're trying to put those pieces back together. So that's a great reminder of something we had before that I think we want to go back and revisit and make sure we're putting that back in place now that we can be in person again.
Thank you, Kim. Dr. Warren, that is the questions that we've received.
Okay. I would be interested, Nick, since we have all of this tremendous brain power here, is there anything that maybe some of them might want to add to this in terms of sharing information with the rest of the folks? Because you don't get this kind of opportunity every day.
Thank you, Dr. Warren. That's why you're such a great host. We got to squeeze everything we can out of for helping our community. Crystal, I'm going to turn it to you to introduce yourself. You don't need an introduction, but you actually come from child welfare. Maybe you could talk a little bit about your role and how it's actually what you're doing with your colleagues in serving the community. So, Crystal, to you.
Thank you, Nick, and hi, everyone. My name is Crystal Skirvin, and I am a regional community coordinator in the Department of Homeless Solutions and Equitable Communities, and that's in the Office of Equitable Communities. And this is a pretty new office for us. We just celebrated our 1-year anniversary. I've actually been in this position about 7 months. And like Nick said, prior to that, all of my experience was in child welfare. So I've worked really closely with this team. I'm aware, I've got that historical knowledge of what was going on and how hard we worked to really turn things around in child welfare. And so currently in my new position, it's all about getting out into the community, getting feedback, hearing, you know, from everyone, all the residents out there, to see what kinds of things do we need to do different. You know, we think, you know, once we're in the county and we have ideas about what we want to do and how we're making a difference, but to really get that feedback from the community as well. And so I host, there are 6 of us, regional community coordinators. And again, I'm in Central Region and I host the Central Region Leadership Team meetings. And we really work, you know, we have community-based organizations, community members that come to these meetings, and we really work to develop strategies to impact a lot of the disparities we see in the community. We currently have identified 3 priorities, and those are housing and security, health and well-being, and economic vitality and education. And this is specifically, I'm only talking about Central Region right now. And so figuring out what we can do, again, to impact the health disparities that we see in our community, working really close with child welfare, with Dr. Keisha on Faith in Motion, so we can pull in those faith leaders. We talked about one church, one child. We talk about that all the time because I think we all remember that, and it really made an impact and it stuck with us. And so we have been out at the churches trying to figure out, again, if you can't adopt or become a resource family, what support can you give? Can you help us with visits? Can you do what Kim was talking about and provide some, supplies and things for a resource family? Or, can you wrap your hands around a family so that a child doesn't come into care? And so really, that's, again, this position is just making sure we get the community's voice, and that when we need to pivot and make some changes, that we know what those changes are and that we're able to go that route.
Thank you, Chris.
Nick.
One of the questions that come to mind for me as I listen and you talk about regional work being done, Black Men and Women United, we have adopted Bell Middle School. We did this a couple of years ago. We created a pantry. There were a lot of kids there, couch surfing. We make sure they have all kinds of supplies, food to take home on the weekend. And we just put a lot of resources in there. The age-old question that I have, Nick, and to all of you that keeps coming, when I hear about all the good work, is still how do we get the word out to the community other than at the point of crisis? And from where we sit as the paper, I see our paper as a partner with Health and Human Services. And when I say a partner, as Nick and some of you know, we've done things like throughout the pandemic, we've printed the county health ordinances. We have donated copies of our papers with that to go in the various food distribution boxes, because everybody is not sitting home watching a press conference in terms of what takes place. And so I'm opening our resources to do some letters and goodwill stories if we get them from you. And there's not a charge for doing that, because people need to know what good is being done. And a lot of people don't get to see it. I mean, I'm just been invited to try to help to do something with the foster grandparents. They're having a big event at the end of the month. You mentioned, Dr. Giordano, the First Five organization. And Nick knows that for years, we have had absolutely zero contact with them. It's like, I've been to the events. I don't see a lot of African Americans participating. I see all kinds of promotional activity going on in kids, but I don't see it being presented in such a way that people know that this is a resource that they can turn to. And we don't want to wait until the new Live Well Center is built to start letting people know that we are a resource that's available, okay? Because right now we're moving into a number of crisis areas. We got a report just yesterday in our meeting about, on the one hand, the number of COVID cases might be going down, but flu and other things are going up. And in one instance, we had a school that had 2,500 kids and 1,000 of them were out with the flu, supposedly. And so there are a lot of issues here, and you got a lot of people doing good things, but we don't know about them. And that's the issue. We got to find a way to let people know so that you're not just telling them when you're reacting to an allegation or a crisis. And I don't mean to be long-winded with that, Nick, but that's my standard speech on this.
No, it's spot on, Dr. Warren. We've talked about this over time, and you were very helpful to us during COVID, right? We held forums together, how to get the word out about the importance of testing and tracing and then vaccinations. And so there we were a bit, reactive and proactive as best we can, dealing with the pandemic. But that's why we're doing these series too. And, we appreciate you doing and talking about and ongoing the different things we're doing. I mean, you mentioned another public health issue about the flu. It's a big issue, right? That's another conversation. Or the Medi-Cal retermination. Once the emergency is over, we have potentially tens of thousands of folks that may drop off Medi-Cal. We're doing everything like crazy for that to prevent that from happening. So there are a host of other things, right, that we're working on, and getting the word out is, to your point, is important. And I'm hoping that we'll get good feedback on these series so we can do more and more of these to come. Dr. Warren, we did get one more question in, and I think time permits. If it's
Great.
okay, we could jump to that question.
Go
Okay.
right ahead.
And this is, Pat, with regards to data on the termination of parental rights for Black parents, data demonstrates that 1.5% of Black children will experience a termination of parental rights by age 18. Black children are 2.4 times more likely to experience a termination of both parents' rights than white children. County San Diego data shows that nearly 2,000 Black children experience a termination of parental rights over a 3-year period. This data is shocking, but I'm not surprised. I believe it's time to create an African American, Native American advisory committee to provide community oversight over the family regulation system. I think it's a statement, but I'll turn it to Kim if you'd like to respond to that.
Yeah, thanks, Nick. This is actually an issue that we've been taking a look at with our race and equity ad hoc as part of the Child and Family Strengthening Advisory Board. We actually met just last week. I'm not sure where the number 2,000 came from. The data we shared last week, we had 87 African American children over a 3-year period that had a termination of parental rights. The disproportionality data is accurate, right? We still have challenges with African American children having higher rates of termination of parental rights than white children. And so I think we would really love community members to participate in that race and equity ad hoc so that we can think of different strategies that can help us address these disparities like the one that we see with termination of parental rights and adoption.
Thank you, Kim. And we're going to wrap up here. I want to, before we thank everyone, I just want to just give, as Dr. Warren said, we have a lot of folks here from the team. Is there anyone else that would like to add anything before we close on this? Not end, but close this session, but not end this work.
Right.
But is there anyone that would add anything further? Okay. Dr. Warren, I'll call on you for that. All right. So I'll give you, if you would like to just kind of wrap up, and then Dr. Warren will close this out. So I'll turn it to you for final thoughts and statements.
Were you giving to someone, Nick?
As Kim, we're going to give you the last opportunity.
Okay.
If you'd like to share. Yeah.
Okay.
Thanks, Nick. You know, I think just we do need help. You know, we can't do this work alone. And so I think there are a couple things that I would really love the community to support us in. One is really thinking about how we support resource families. So we need help recruiting African American families to be foster parents. We also need help getting the word out that the laws have changed around relative placement. And so hopefully alleviating some of the fear and mistrust, that's understandably so that relatives will want to be part of helping care for children that are involved in our system. And then, like I said, helping us develop some strategies. So being part of our race and equity ad hoc subcommittee or participating in other ways. We're doing a series of stakeholder sessions right now around the work that we're trying to do to transform into a child and family well-being system. Those are participating in all of the Live Well leadership sessions like the ones that Crystal leads in Central Region, but in all of our regions. And we really want to hear from the community. What is needed? What should this look like? What is going to be the best way to get to better outcomes for families? We don't have all the expertise, and so we really need some help in this. So again, just really thankful for the opportunity to be here with everybody tonight and share some of this work and engage deeper with our community.
Thank you, Kim. We appreciate that. And I want to just thank everyone for joining us this evening and engaging and asking really insightful questions. As Kim pointed out, we need your help. This is San Diego helping our kids. And I say San Diego, not just government, but our community. And very importantly, although this is our first, it's not the only community conversation that we're hosting with Voice and Viewpoint. Actually, next month, on November 16th, is our next town hall. This one, I know Dr. Warren's very passionate about this topic too, behavioral health. We're going to cover a lot, but focus on mental health for our youth in particular, a very important topic at any time, and even more so as we emerge from COVID and its lasting consequences. And then in December, on December 14th, we'll be back to talk about still another pretty important topic, homelessness. And we have our new county homeless solutions in local communities. They'll talk about their work that we're doing in the city of San Diego and throughout all cities in an incorporated area. We hope that you'll be able to join us and bring your friends, bring neighbors. We want to grow this. I want to thank you again for participating in this evening's town hall. My sincere thanks to my team, my great team here in Child Welfare and the agency, and especially Dr. Warren for
Nick,
helping this town hall.
I
Dr. Warren, with that, I'm going to.
Yeah, I want to offer something before we go real quick. I would like very much to replicate what we did here tonight in the paper. So if I could get a situation where each person was on, you get a photo, you give a spiel about what your part is that you do. I give a half-page space. There's no charge. I'm donating it because I want the public to have a memorable piece of what's taking place. We also will put it on the internet, and that will be a way of at least introducing what you're doing. I'm not opening the floodgates and going for free, but I am making it possible to put this piece out there so that everybody who missed what we're doing here get a chance to see, and that will also hopefully drive people to the next two sessions that we're going to do. Is that okay, Nick?
Who says Santa Claus doesn't come in October? I mean, how many people are offering that? Thank you, Dr. Warren. That's very gracious and appreciative. And I'd love to have Kim share the work and the challenges and help, and Dr. Clark to talk about her work inside Child Welfare, and Crystal talking about what she's doing in the community with Elizabeth. There's a lot of honestly good things, important things, and we would honor that opportunity. So thank you, Dr. Warren. Dr. Warren, please
include everybody on the team, Nick. I don't want to leave anybody out. Some people didn't say anything, and yet they're still doing stuff. So I just wanted to be inclusive of all of those who participated tonight. And I'm through. Thank you.
Well, with that, Dr. Warren, thank you. We will definitely follow up with you on that and provide that. Again, thank you all for this evening and joining us. And we'll hopefully see you at next month's forum. Take care.
Okay.
Have a good evening.
Thank you, everyone. Bye.